It's a really big business story. It's going to affect your family and your money. After yesterday's executive order to unravel parts of Obamacare, President Trump took another step to unwind Obama's health reform legacy bill. President Trump immediately stopped subsidy payments to insurers for plans in the exchanges. And now Democrats claim that move will break the insurance markets and collapse them. We've got breaking news, too. 15 states are now suing the Trump administration to stop the president. Here's the president tweeting this morning, quote, "The Democrats' Obamacare is imploding. Massive subsidy payments to their pet insurance companies has stopped. Democrats should call me to fix." Critics say Obama did an unconstitutional end run around Congress with these payments to insurers, arguing it was the insurers. Now, this is the argument for the critics, that it's the insurers who benefit, not and the poor and the sick who get help from these subsidies. It mostly helps the insurers. Let's take a look at the health insurer stocks. End of the day to the downside. And look at that. Only Campania Energetica in the green. Let's bring in Doc Siegel. Good to see you, Doc. Good move today. OK, he inherited a mess. And now it's sort of like both Republicans and House Democrats not doing anything to fix Obamacare. It's sort of, the joke was, it's sort of like they're smoking in bed while the house is on fire, right? So do you like what the president did today?
I think for the largest extent, it's a step in the right direction, and I'll tell you why. I don't believe that the state exchanges were working, and we have a lot of evidence of that. And you know what the biggest evidence is, Liz? It's the 6.5 million people who paid the tax penalty. Not even the 8 million that were assessed it, but the 6.5 who actually paid it, who said, I would rather pay a tax penalty than pay a premium and have such a high deductible that I don't have a workable product that can get me actual health care. I'm going to wait till I get sick. And then Aetna's CEO said last year, you know why I'm dropping out of the exchanges? Because 55% of the patients I get are already sick or have chronic conditions. That's what President Trump inherited. And he's basically saying, in terms of one executive order, he's basically saying, let me offer those who took the tax penalty something that might actually work, something that's based on small insurers grouping up, providing a plan that doesn't have all these essential benefits.
All right, but how do you deal with the pre-existing conditions and the sick and the elderly? The stat is out there, 5% of the population were responsible for 50% of the health care costs. So how will the president deal with that?
Well, I'll tell you how you don't deal with that. You don't deal with that by asking a 28-year-old who's just starting out in life to pay for a 70-year-old who smoked themselves into emphysema, or someone that weighs too much and has diabetes that I deal with every day. I don't want my healthy 28-year-olds to pay for that. That's called cost sharing. The government wants to take seriously paying for very sick people or poor people. They should do it directly. That's who should get subsidies. That's what high-risk pools are called. But if you don't want to call it a high-risk pool, let's have a two-tiered system where one tier can get insurance for the healthy, catastrophic or skinny insurance. That's what this bill allows. Again, if it's a trade association or small businesses grouping up, something that will give us an alternative that's a skinny plan that will work. Not a junk plan, a skinny plan that doesn't have all these benefits. And then the government can subsidize those that are on the exchanges with pre-existing conditions. That's what I would think would work better. I think overall, Liz, you're going to see more people insured as a result. Because people that took that tax penalty will say, well, wait a minute. I'll take a catastrophic plan. I don't want to end up in an emergency room going bankrupt.